The broadcast is now starting. All attendees are in listen-only mode.
Good morning, good afternoon, wherever you are, and welcome to this new webinar organized by the Maternal Health Supplies Caucus of the Reproductive Health Supplies Coalition. My name is Milka Dinev. I'm the technical lead in maternal health for the coalition, and I also coordinate the LAC Forum. Today we have an interesting webinar on solar energy, an alternative solution on challenges in the management of the cold chain. With all the conversations happening worldwide on management of vaccines, we thought that this was a very appropriate webinar at this time. So you are all muted in order to prevent background noises. This webinar is being recorded, and a link to the audio and video will be sent to all members of the caucus and to all participants in a couple of days. We will not open the microphone, but you are most welcome to write your questions in the questions box at the right-hand side window of your GoToWebinar platform. Our presenter today is Abdoulaye Gueye, and in the invite you have seen his biography. Abdoulaye Gueye obtained a master's degree in natural sciences and biology at Cheikh Anta Diop University in Dakar and an MBA in organizational management at the Institut Supérieur de Management de Dakar. He's currently working with PATH in Senegal as a senior program officer for the last 8 years in the field of supply chain management and cold chain management for vaccines. Abdoulaye has field tested several vaccine conservation devices such as ARTEC, passive long-term vaccine conservation device designed by the Intellectual Ventures Global Good Laboratory based in Seattle, and other conservation devices coupled with kits to recover excess energy from solar panels. Abdoulaye has 15 years experience in the management of health programs in Senegal. So welcome, Abdoulaye. You have your microphone open. The floor is yours. Thank you.
Thank you so much, Milka. Today, I would like to share with you past experience in solar energy through a project called EHC, Energy Harvesting Control Study, in facilities located in remote areas. The contents of this presentation are, first of all, the context of the study, understanding every energy harvest control, what that it means, the needs addressed by EHC. I will present the field evaluation in Senegal, the results, and the discussion we had with the health workers after we ended the project. In many countries, as you may know, the API is associated with an improved cold chain to provide preventive health services to newborn and women living in remote areas. Certain innovations recognized as essential tools to achieve their objectives are accompanied by an increased demand for renewable electrical energy in healthcare establishments, remote monitoring of temperatures, use of mobile applications, etc. In general, solar panels produce excess energy that refrigerators don't consume. And new generation solar refrigerators are equipped by an energy recovery control called EHC device that can partially meet the electricity needs of a remote health center or a post center, while prioritizing vaccine and other sensitive drugs like oxytocin storage. We will try to understand the meaning of energy harvesting controls. In the past, in many health posts or health center, you find a refrigerator connected directly to a solar panel. But the refrigerator will not use the totality of the energy, and most of the energy will go to the wet stage. And solar arrays powering solar direct drive appliances often generate surplus power that goes, as I said, to wet stage. We did first during the project a lab measurement, and in this graphic you can see how were the findings. Lab measurement SDD, solar direct drive refrigerator energy consumption, are at the yellow part area, and we try to compare and model daily incident solar energy with this yellow part. We use it solar panel for a 450 watt area. And here in the graphic, you can see the wattage, the energy wastage between the energy used by the refrigerator and the energy provided by the solar panel. We try in this project to use the surplus, the power surplus energy in order to run some material, some medical equipment in the health posts and provide light to the health facilities. We have here 3 examples. In the first one, it is the basic one, the basic system. Here, the refrigerator is connected to the solar panel, and we can connect only a fan, and this system will permit to recharge also a cell phone. In the second example, with a kid health center that you see at the middle, here we can use the excess of energy to run a fan, to recharge a cell phone, and to provide light at the health facilities. In the example number 3, it is the most complex. You can have a battery where you can store the excess of the energy, and so you will have light at the health centers. You will also be able to run a fan, to recharge cell phone, and to and sometimes if you have more excess energy, you can recharge your laptop. And here we tried to do a comparison of the three systems. The first one, the basic one, you can recharge a mobile phone and other sample USB devices provided by the users. The capacity we had was around 50 watt hour per day, and the cost is a little bit low, and you will not need an assessment during at the beginning of the project. The second one is the system that you will use a kit, a health center kit that I show you in the other slide. Here you can recharge a mobile phone and other sample devices provided by users, as well as devices provided by the equipment manufacturer, as a mobile lamp. The capacity of the excess energy we have here is about 100 watt hour per day, and the initial cost is medium. And here you can do an assessment, a site assessment at the beginning of the project or not. The last one is more complex, and here you can install light at the health facilities, AC outlet, and other built in the infrastructure. The quantity of energy we have here is about 1,000 watt per day, and the initial cost is the highest, and you have to do a site assessment at the beginning of the project. Here you have the cost saving by the system we use during this project compared to the standard system. And here you can see in red the solar device with not cost saving, and in green the solar device with cost saving, and in blue you can see the current solar device cost. And we did the study during 1 year of electrical outage. And what is the need addressed by ERC? The need addressed by the energy harvesting control. First of all, there is a need for electrification. Energy plays an important role in lighting, vaccine and sensitive drug storage, sterilization of tools in the health post or health center, and communication in the health facilities. Access to midwives and electricity at health facilities had a great impact, reducing the maternal fatality rate during emergency obstetric care by as much as 80%. Out of the 32 low and middle income countries, approximately 7,400 health facilities are equipped with solar direct drive appliances and could benefit from energy harvest control technology. It is from a PAF internal data. The second need is a better health care through energy harvesting control. Communication. Charging cell phone is a challenge in remote area. And with this project, we provided it was able to the health workers to charge their cell phone from the refrigerator. They use also remote temperature monitoring devices running with the excess of energy, and other similar device fosters communication. The management of health emergencies, enabling use of devices such as lights for emergencies of birth that happen at night, and fetal Doppler heart rate monitors for emergency obstetric care. Access to health care, decreasing the amount of time health workers spend away from health facilities charging their device. Quality of service, providing basic lighting and fans can help foster patient trust and improve perceptions regarding the reliability and quality of their health system. Now we are coming to the field evaluation in Senegal. The work was conducted in Thiès and Kaolack, regions of Senegal. Thiès is located in the west of the country, and Kaolack in the west center of the country. And here are the devices we provide to the health workers during the project in order to use the excess of energy to run these devices. We provide to the health workers fan, headlamps, battery bank, fetal Doppler, light lantern, USB battery charger, and otoscope. And here are the results of the study. The first challenge was to keep the vaccine compartment between 2 and 3 and between 2 and 8 degrees Celsius in order to maintain the vaccine safe. And during all the project, vaccine compartment temperature remained within acceptable limits despite energy harvesting. And here you can see some large temperature peak that correspond to door open events when the health workers need to open the door of the refrigerator in order to take some vaccines. And here you have two graphics that show the energy we harvested during the project for the basic EHC system and for the EHC system with a kit, the health center kit. In red, you have the solar array, the capacity, the amount of energy from the solar array to the refrigerator. In blue, you have the quantity of energy from the refrigerator to the load, to the equipment. And in green, you have the estimated array output. And you can see here the space from the red curve to the green curve are the energy we harvested during the project and during this period. And it is the same for the kids health center. The space you have between the red curve and the green curve is the amount of is the quantity of energy we harvested in order to run some equipment in the health center. And after the study, we have discussion with the health facility personnel. And here are some ascertained reported. From the head nurse number 1, he said that now they, health workers, get light at night when women are giving birth or when they have urgency, instead of using candles like from mobile phone or flashlight lamps. From the head nurse number 2, from the ESC project, the Energy Harvesting Control Project, we now have medical material to better diagnose our patients, especially pregnant women, because we can use photon Doppler and otoscope. From the health workers number 1, he said that the energy harvesting control improves immunization services, night services, and detection of fatal suffering. And the last one said that I no longer go elsewhere to recharge my mobile phone. And here are the conclusion and learning from the study. The SDD, the solar direct drive, and energy harvesting control equipment generally worked as intended. Any amount of electricity is useful to health centers, but remote facilities could utilize more to expand service. All temperature data from the vaccine refrigerator were acceptable, and no refrigerator functions were compromised by including the energy harvesting control. The efficiency and time gains may increase health workers' availability for health service delivery or improve work-life balance. Results were not conclusive due to the limited sample size in this study. Service providers should be highly qualified and trained to perform installation and maintenance. And about the ongoing work and follow-up, there were EHC equipment fault during the study, but they did not compromise refrigerator performance, a key requirement that EHC fail safely. We are still following up with manufacturers to diagnose the root cause of the fault. As part of the PKS working group, we continue to follow up on quality concerns and any implications. This has emphasized the need for an agility of the PKS requirement to run field trials in addition to laboratory performance verification testing. These trials frequently uncover issues with equipment. As many devices can be charged by energy harvesting control, training may be required on this device. For example, one head nurse noted that she had to be trained by a gynecologist at another site to use the fetal Doppler. Qualified service technicians are an important factor for repairing any device issue during the project. Thank you so much for your attention. It was the presentation I would like to share with you. Thank you so much. Over.
Thank you so much, Abdullah. It's very interesting, all this work that you have done in energy harvesting. As more and more countries are buying solar fridges for the COVID-19 vaccines, this kind of information is extremely useful. I don't see any questions yet. So if people would like to ask their questions, let us know. You should just write it in the questions panel. It shows at the right hand side of your screen. Okay. So I have a question from Susan Ochere, and she's saying, how much was the investment, please?
Thank you so much. For the basic one, the investment was around 3 million CFA for buying all the equipment and also paying some per diem to the health workers who were involved on the study. And for the complex system, the investment was around 5 million, including the material, the refrigerator, and also the per diem we paid to the health workers.
It's $5 million?
No, CFA.
In dollars, that would be approximately?
You will divide by 600.
Divide by 600.
Yeah.
So about 300,000, right?
Yeah, right.
Okay. I have another question by Lotte Bengal. Who is in charge of maintenance, please?
Yes, thank you for this question. Yeah, during the project, the maintenance was provided by a service delivery, a private service we contracted during all the duration of the project. And the maintenance include one site visit per month And when it occurred that a material broke down, they sent to us a bill, and if I remember, the bill was about the first one was about in CFA 3,000.
So, do you have people in Senegal that are able to repair both the fridges and the solar panels?
Yes, we have here in Senegal
Good.
qualified people who are able to repair the solar panel, and no, the solar panel don't need to be repaired. You have just to maintain. You have just to clean the solar panel. But we have also personnel who are able to repair the refrigerator or the equipment, the secondary equipment, if it's broken.
So, Abdullah, we have another question here. We have several coming. Nancy Mueller from PATH is asking, thanks for the great presentation. Can you talk about whether all solar, Nancy Mueller from JSI, I believe. Thanks for the great presentation. Can you talk about whether all solar refrigerators can be used for excess harvesting?
Thank you, Nancy, for your question. No, the answer is no. Right now, we have some new generation of refrigerator that you can use for an energy harvesting project, but the old, you cannot use the old generation of refrigerator for an energy harvesting control.
We have another question here from Saumya Ramarao from Population Council. Would it be right to conclude that even with the third model of EHC, there is still more excess energy than consumption?
Yes, in the second, thank you for your question. In the second system, you have more consumption because of you have more equipment used for this system. You have a fan, you have about 3 or 4 lamps in the half facilities. You can recharge your cell phone, you can recharge your laptop, and also you can use a Doppler, a photon Doppler. That's why the consumption is a little bit higher. And during all the projects, we was able to manage this consumption. But to answer to your question, yes, in the second system, you will have more consumption.
And we have another question from Susan Ochere. Were the equipment materials purchased locally?
No, all the material was ordered abroad. The solar panel, the refrigerator, and also the equipment. All the material was ordered from abroad.
Okay, I think you've answered this question. Nancy Mueller was asking if you can clarify the types of other equipment that can be charged, laptops or other medical equipment. And you said yes, laptop, cell phone, Doppler, you could, the fan, right?
Yes. In the second system, in the first system, the basic one, you cannot. You have just to recharge a cell phone. You can have 3 lights and recharge a Doppler.
Yeah.
But you cannot have, you cannot recharge a laptop, and you cannot have a fan also.
And Lotte is asking if you have problems of supply of solar energy during the rainy season. Are there any problems
Thank you
of
so
solar
much for this question.
supply?
No, during the rainy season, we didn't have a problem with the solar panel, because here in Senegal, we don't have rain during all the day. The duration of rain is about 3 to average 2-3 hours, and after that you will continue to have solar. And the other things is, even if you have clouds or if it is raining, the system will keep some energy to use during 5 hours, 6 hours, sometimes 1 day, in order to run the fridge. But the other things is, during this period, you will not be able to recharge equipment like a cell phone or laptop, because the totality of the energy will be used by the refrigerator.
Right.
Thank you.
This is an interesting question, Abdoulaye, and I also wondered this. Susan Ochere is asking, you mentioned that you paid some per diems to the staff. Going forward, will per diem continue? How will you sustain the effort?
Okay, thank you so much. Yes, I agree. It is a good question. During the project, during the study, we organized some workshop and some field visit with the health workers. And as you may know, here, when you organize a workshop, you will pay per diem to the participant. It is a kind of per diem we paid during the study. But after the project, we will the government, the Ministry of Health, will continue to run the project. And I think that they will not organize a workshop, because all the health all the health workers where the project is performed are right now well trained. I think that they will not need to pay additional per diem during the rest of the project.
And we have an excellent correction by James Mlali. He corrected my math. Hi, Milka, he says 5 million CFA would be around 8,333 US dollars. So the 5 million CFA was for each facility, or?
Yes, it was for
each facility. Yes, right. So it's 8,333 the investment. Then we have comments saying, great presentation, thank you so much. And James is asking whether the project is being scaled up, where and by who.
Yeah, thank you so much. It is also a good question. As you know, here in Africa, the main issue is the handover of the project when it ends. For this project, we did a donation of all the equipment to Ministry of Health and in charge to them to continue to run the project. And right now they are doing a good job, but in the future, I don't know if they will continue. They will be able to continue to well perform the project. But right now they are doing a very good job.
And we have a final question here. How many days of typical energy consumption can the inverter hold? This is a question by Saumya Ramarao.
Yes, during the project, we learned that with the refrigerator we use, you can harvest 1 day of energy in to permit that when you have, as I said, cloud or
a cloudy day.
Or when it, yes, a cloudy day when it is running, the vaccine will be continue to be safe in the refrigerator. But during this period, you will just avoid to open the refrigerator, and you will also avoid to run the other equipment, the other harvesting equipment.
Abdullahi, and what is your opinion about investing in the inverter?
Yes, I think that during the project we learned that the inverter plays a great role, because without the inverter you cannot recharge a laptop. And here in remote area, health workers are facing a challenge to send their data at the end of the week or at the end of the month, and they need to recharge their laptop. And without an inverter, you cannot recharge your laptop.
I was also wondering, you know, at the Maternal Health Supplies Caucus, one of our focus commodities is oxytocin. In your experience in these facilities where you provided the solar fridges and all the other equipment, were they keeping the oxytocin in the refrigerator? Is this something that you saw during your work?
Yes, just to please note that in Senegal, the policy is to not store the oxytocin with the vaccine. It is the Ministry of Health policy. But in the real life, at the remote area, you will find oxytocin in the vaccine refrigerator, because the health workers didn't have location to store.
Right, they didn't have another refrigerator. You know, yes. With the caucus, we have prepared a lot of materials on the need to keep oxytocin in refrigerators, and there is a joint statement of WHO, UNICEF, and UNFPA recommending that the refrigerators that hold the vaccines could also hold other temperature sensitive products. So hopefully you will be able to advocate with the government of Senegal that the refrigerators should be used if there's only one in a facility, right?
Yes, right. Thank you so much for this insight. Yes, I am doing a lot of advocacy about this aspect, because you cannot have a refrigerator with good space to store vaccine and oxytocin, and ask to the health workers to not store oxytocin in the same refrigerator, because we cannot have in each facilities two refrigerator, one to store vaccine and another one to store oxytocin. It's not a cost save.
Right.
What I advocate, what I ask always when to the health workers when I am on the field is just to separate the two products in order to not confuse those products, because in some country, I don't know if you are aware, health workers are confusing some the oxytocin with vaccine product, and it can occur several. It can be a danger.
Well, thank you so much, Abdullahi. We have very interesting topic and very appropriate at this time when everybody is thinking about vaccines and refrigerators and products that are temperature sensitive. It's been great to have you, and thank you to all participants for your wonderful questions and your attention. As I mentioned when we started, this webinar has been recorded, and you will receive the recording as well as the PowerPoint presentation. And again, Abdullahi, thank you so much for the time and the effort of doing this presentation. You can say goodbye and close the webinar for us.
Thank you so much, Milka. Thank you for all the participants. And sorry again for my bad English. I appreciate your participation, and see you next time. Thank you so much.
Well done. Thank you so much. See you hopefully in the near future, or talk to you in the near future. Bye-bye.
Bye.